Hi, good morning. This is Dr. Karthik Gunasekharan, Director of Metromale Clinic based in Chennai. These are difficult times for us with the lockdown and all, but we're still managing to see quite a few patients. Today's video, I thought I'll do a brief one on how to do a Kegel exercise properly. Now, I'm sure like you must have seen a few of my videos talking about a Kegel exercise in a supine position where I'm lying on the floor and then I actually perform the Kegel and show you. But a lot of people like don't find it like convenient to like actually do the exercise like an exercise, but rather do a Kegel, during your daily routine work. Meaning, if you're sitting in front of the computer, meaning if you're like just like watching TV, if you're reading a newspaper, browsing your mobile, whatever. So just to recall what the Kegel is. So the Kegel exercise was basically, proposed by this gentleman, one Mr. Arnold Kegel. So what he said was the pelvic floor muscles. Now the pelvic floor is basically a diamond-shaped structure inside your pelvic bone, right, at the level of the hip. Now the pelvic floor extends between the pubic bone, which is in the front, and the coccyx bone, which is behind, right? And on the sides, you have the lateral pelvic walls where the pelvic muscles go to and get attached, right? Now, these pelvic floor muscles form a support, right? And this support is actually pierced by two openings. The important opening in the man is the urinary opening and the anal opening. In the woman, you also have the vaginal opening, right? So these openings pierce the pelvic floor. So any exercise that you do needs to be around these openings. So Kegel basically proposed that these muscles that surround these openings need to be exercised or strengthened for these openings to be active or to be kept in a constant tone, right? Or rather a normal tone. Now, how do we do a Kegel? Just sitting. Okay, so that is what I'm trying to teach you today. So the most important part of the Kegel is to elevate the pelvic floor. You mean raise the pelvic floor, right? In a woman can basically do it by trying to pull the vagina up, right? Pull the vagina up. Or in a man, he can basically try to do it by trying to shorten or pull the penis up. So you do a movement using your pelvic muscles where you actually pull the penis up or try to shorten the length of the penis. So that's the single most important thing. If it is a female, she does it by just trying to pull the vagina inside. The second movement should involve one of the openings. So the first opening in a man is going to be the urinary opening. So what you need to do is you try and stop the flow of urine. So you have to do a movement like trying to stop the flow of urine. Now, do not do this when you're actually urinating, because then that would lead to other problems. So when you're sitting at rest, after you kind of try and pull the penis, try and stop the flow of urine. Imagine that you're stopping the flow of urine. Now, the third movement you basically want to do is to contract your anal sphincter like you're trying to ward off a bowel movement or you're trying to control the passage of gas. So these three simple steps form one Kegel, right? Now the question is, doctor, how many Kegel exercises should you perform? What are the frequency of these exercises, and what are the repetitions, and how long do I actually need to do them to actually see some improvement? Now these are like, there have been various studies looking at these things, and the science is like, it's still a point of semantics. The science is not exact on this, but to a certain extent, start off at least with like 3 Kegels, do 3 Kegel exercises in the morning, 3 in the afternoon, 3 at night, and try and increase the number of repetitions. It is just very akin to going to a gym. If you go to a gym and you want to do repetitions, you have to keep doing more repetitions to actually see strength, or you just increase the load. Here you can't increase the load too much, so you have to count on the repetitions. So from 3 repetitions work to about like 10 repetitions. So 10 repetitions in the morning, 10 in the afternoon, 10 at night. Now how long do you have to hold the Kegels? Now when you hold the contraction, try and do it for at least about 5 seconds to begin with. Go to about 10 seconds. You can go also up to about 30 seconds when you become an expert, say after about 3 months, in order for your quick ejaculation problems to go away. So this definitely helps with your erection as well as your ejaculation problems. It is exactly like doing biceps exercises. The more you do them, the better your biceps look, but once you stop them, it again reverts back to normal. So these have to be done constantly. In order for you to see any kind of improvement at all, it will definitely take a period of 6 months at least. Hope you understood these exercises. Please keep practicing them and please keep posting any questions that you have. See you there.